Hello and welcome to part two of my video on longevity medicine protocols for massage therapists and how massage therapists may be able to use genetic testing that their client has had as a part of their client's longevity medicine protocol to help improve the massage. So if you want to go to part one, I took this genetic testing from Alter and I tell you a little bit more about the process. You can understand what your longevity medicine client would have gone through if they went through the process of getting genetic testing. But now I want to ask some really interesting, really great questions about how we can use this as the massage therapist helping somebody on a longevity medicine protocol. So I'll briefly go over the different things that the altered genetic testing kind of told me about my genes. It talks about the best possible exercise for the client, whether cardio, mixed, or strength-based. Talks about the ease of weight loss, the ease of keeping weight off, the impact of eating carbohydrates, the impact of eating protein, the impact of eating fats. But more interesting for the massage therapists are the second half of them, and that is their inflammation risk, their motivation, their bone density risk, their mental decline risk, their chronotype, so whether they're a morning person, afternoon person, and their stress and anxiety resilience. So how can we use some of these in conversation with our clients on a longevity medicine protocol to kind of time and customize the factors of the massage that we're giving to them. So this would be over and above the general research that shows the general benefits of massage for all populations. This is specifically on your DNA. What do I recommend we do in your particular massage? So exciting, right? It's so exciting. These things didn't exist when we were younger in the beginning of our massage careers, but we can adapt to the times and really help our longevity medicine protocol clients. So the first one is maybe the most exciting for me, their inflammation risk. So if they're looking to possibly reduce inflammation, they can see whether they have an average or above average likelihood to have inflammation in their body. So if we're going to talk about doing anti-inflammatory massage protocols, that would be something I would definitely be interested in talking about with a client who had an above average genetic predisposition towards creating inflammation in their body. Okay, what about motivation? So are they internally motivated or externally motivated? Are they focused on maybe doing the exercise because they like to exercise, doing the massage because they like how it feels, or are they externally motivated? So I'm personally, according to my genetics, externally motivated. In my life, I see it. I need a goal. How I first got into massage was doing it to stay healthy so I could climb Mount Kilimanjaro. So the longevity massage therapy is going to be customized to tell them we're going to do this because of the way it makes you feel afterwards if they're internally motivated. So like take a moment, feel inside your body, how do you feel? Or if they're externally motivated, we can really share the science with them on different types of massage and how that would help them in their longevity medicine protocol. And you could even possibly use their testing if they're having regular blood work with their longevity medicine protocol provider, like their naturopath. And then maybe if it's external motivation, get the naturopath involved, get a naturopath who's really excited in the benefits of massage and well versed in the benefits of massage to talk to them about how this is an important part of their protocol. Okay, so understanding motivation, super interesting in how to get adherence to their whole protocol and their massage. And really talk to them in the language that they understand, because if someone is focused on an external goal of, I want my health span to be longer, maybe we're not talking to them in a way that they can listen and really understand. If we're like, oh, but you feel more comfortable in your body, we need to talk about external goals that they have. So I would talk to someone like, if you feel more comfortable in your body, you're going to be more able to exercise. And if you're more able to exercise, more able to complete the activities of daily living, because you feel a greater range of motion, you're going to be able to do more. And then that is going to improve your health span, because we know that from the science. If you are able to stay active longer, you're able to have a longer health span. Okay, bone density risk. So this is very important. If someone has an above average bone density risk, um, I would be very hesitant to use deep tissue techniques on them, particularly near the spine, in the same way as an oncology massage therapist. If someone has a breast cancer history and they've taken certain of those chemotherapies or certain of the treatments, I'm hesitant to do deep tissue work near certain areas of the body that may be more likely to fracture, like the spine areas. So that would be an important way to really talk to the client specifically about why we're helping keep them safe. If they have an above average bone density risk, they should be doing a lot of other things in their protocol to help increase bone density, which the person who does the longevity medicine protocol for them should have that conversation with them. But us as the massage therapist, I can keep you safe by making sure I don't accidentally injure you. Um, Chronotype. I like Chronotype. They'll be able to see whether you're an evening person or a morning person. So how does that have to do with massage? If we're fit into their schedule at the wrong time, they may be, dragging to this massage and feeling like I've done so much, I'm exhausted. I just can't take one more thing today. I have to cancel. Or if we're trying to book those 9 a.m. massages with someone who's not a morning person, they're dragging in there and they can't get there on time. So it's really good to understand their chronotype. And then maybe a little bit with the mental decline, but I think you can also see this um, in your clients that just generally exhibit brain fog and other issues. If it's difficult for them to remember appointments, then you have to do, as the massage therapist, the reminders to help them. And I've been doing this with clients for a long time because I started out as an oncology massage therapist, and you have to meet the clients where they are. So if someone needs a text in the morning to say, hey, I'm looking forward to our massage at 11 a.m. at this address, then that's what I do. So have the conversation with the client and see where they are and how you can help them. So the system that I use for massage booking gives them a 24-hour before the appointment reminder. But for one client, I really needed to give her, she wanted to text me the morning of, just to triple check that this is happening to her today, kind of to help her remember. And then I would be very proactive and I would text her as well. I'm looking forward to seeing you at 11 a.m. And then that would get her that like 2 hour, 3 hour before reminder that would allow her to organize her schedule, and she was on time to the appointment. So do what we need to do for our clients to meet them, to help them make their appointments, keep their appointments with us. And then finally, last but not least, stress and anxiety resilience. If they have issues with stress, handling stress and anxiety that they can see on the genetic testing, can we make the case for them that the massage that they're getting from us is helping to reduce their stress and anxiety, helping them to take some stress off their plate, helping their nervous system to regulate, to achieve homeostasis in the body so they can better meet their goals, their objectives, their challenges for the day. And I think if someone understands how their body handles stress, that they can better understand the messages that we're giving to them about the value of massage in reducing stress and helping them to handle stress, and really look into their lives. In the hours, in the days after your massage, did you feel calmer? Did you feel more able to handle the stressors in your lives? Were you responding to issues instead of just a knee-jerk reaction to them? And the stress plus the messages that we can send them about other stress reduction practices, like mindfulness, like breath work, is that really going to help them to better meet their goals and objectives of the day, which will help them improve their health span, because a lot of their goals for their day has to do with activities that will keep them healthy for years to come. So this is my little tiny video just talking about some interesting questions, some interesting conversation that you can have with your clients who have gotten the genetic testing, and how you can talk to your clients about how we can personalize their longevity massages as part of their longevity medicine protocol based on what they see from their genetic testing. Thanks, and have a great day.